Hi, it's Dr. Cullen. I'm currently the Pima County Public Health Director with a long history of health IT and information technology development, both in the United States and globally. I'm going to present to you today on global health and digital development and the principles of development. Hopefully this will give you enough information to help guide your work as you go into this area. I want to first show you this really amazing slide. It's been around a long time. It's using technology to improve global health. You can see on here most of the continents are there. I just think Antarctica isn't there. And what you can see is that there's development everywhere. And I think that this is really important to note that there's technology development in low and middle income countries, in other countries, and there's importing and exporting of technology around the globe. Now, we're going to talk a little bit about what we mean by technology and what we mean by development, but it encompasses much more than software and applications, and that's just important for you to remember, that there's lots of information flow happening, lots of development happening, impact for lots of people as we go through this. So what does digital development really refer to? Well, it refers to lots of things. It refers to designing not just technology, but a database, analytic tools, applications. It refers to writing. You're probably familiar with user tech and install manuals, pretty typical triad of manuals that people use for digital development. Never underestimate the critical nature of having good manuals. They are critical to what people do and to their utilization of things. And in my opinion, that's part of development. Also part of development is really using user stories and scenarios, making sure that we design repeatedly for people and that we include them in the storytelling. We're going to talk about that more later on as we go through this. How do you evaluate? What kind of tools are used for evaluation, application, database, algorithms? As you know, artificial intelligence has more and more importance these days, and that's a component to what people use when they talk about digital development. And finally, deploying. How do you deploy? What makes a difference? And we'll talk about that a little more too. What does it mean to have a successful deployment, to be able to scale? But it's just important when you think of digital development that you don't just think of the latest mobile app on your iPhone or on your Android, but you think of these other components, these other technology solutions that contribute to the digital environment. So how do you do development well? Well, change is slow. Nothing happens quick. Sometimes there's major innovation, disruption that occurs, and in those cases, sometimes things go really quickly. But most of the time with digital development, it's pretty slow. The process is slow. Sometimes you can pick out one thing and do that well rapidly, but overall, change occurs slowly. Engagement with stakeholders is critical. You have to include them in what you're doing. If you don't, you will not be successful. And remember, stakeholders is not just end users. It is also the people that support any development you're doing. It's the people that are in the community that may benefit from it. Say you're doing a population health application that looks at diabetes or hypertension screening in a small rural community. The stakeholders include those users. They include the people that will benefit from that application itself. You have to have some principles. I'll leave it up to you to figure out what works for you, but having principles is really important. Developing a playbook. A playbook is really, in some ways, a work product. It's how you get from A to B. It's how you don't miss step A, 1, 2, and you don't end up at B without having done everything you need to do in the middle. This is an example from the US government, but it's actually a really good example. Playbooks are designed to give you guardrails, to make sure that you pay attention to everything that people believe contributes to the success of a project. Remember, you don't want to fail. If you're doing digital development, regardless of where in the cycle, the technology cycle, you want to be successful. And you also do that by paying attention. Attention is critical. If you don't have attention, you're going to get in trouble. You'll forget what you're trying to do. You'll hopscotch. You'll decide, I think this is really important. You know, those glittery objects, I want to put this in here. This functionality is really important. That's where we see projects get in trouble. And then finally, iterate, evaluate, that agile mantra that you've seen, I'm sure. These are principles for digital development. These are been around now for almost 10 years, perhaps a little longer. You can see they're user-centered. They're understanding what you're doing. They're designing for scale, so not 5 people, not even necessarily 1,000 people, maybe 10,000 people. I did some work in China, and many of the people I worked with felt that if they did a mobile app and at the end of a month 10 million people weren't using their app, it wasn't scalable. So your scale is different for everyone, but it's important to note that you design for scale. Build for sustainability. If you want to make a difference, it's got to last at least a while. It can get iterated on, it can get modified, but it has to be sustainable. Be data-driven. Use open standards, open data, open source, open innovation. Obviously, this is not true for everyone. Some of the venture capital funded initiatives are not using open anything because of what they want to do. But if you want to look at low and middle income countries and global health and you want to make a difference, you really need to be using open. Reuse and improve. Once again, this concept of frugality. Make sure that whatever you develop has the potential to be reused. Privacy and security, I'm not going to spend time on that. Note that's critical. I would say that data sovereignty and data privacy and security is critical independent of what community you're in. There's been some indications in the past few decades that people that develop for low and middle income countries think that this is not as critical. It is. People own their data. It doesn't matter if they're in a country that has high technology innovation or is just beginning to do some of that. They still own their data. And finally, be collaborative. HIT ecosystem, I'm not going to go through this, just suffice it, all these wheels have to work together. They're all important. They're all components to what we do. The HIT ecosystem of enabling patient care. Go back to that last slide and remember all those levers and wheels. These are all the other things that affect and enable patient care. Now, many times, if you're developing a small app, if you're doing a mobile app, you actually may not pay attention to all of this, but I would say all of this is important. It's a wheel that you should just run yourself around. Say you're developing an algorithm. You still want to run this around that algorithm. Who's going to own that data? What analytics am I using? What platform is it going to work on? Am I using the function of the patient at the middle? Am I using interoperability standards that can ensure that data can be shared? And the old slide about requirements, hopefully you've all seen this. But you want to swing at the end. You want to swing that moves back and forth, that can really be handled on a limb that supports it and makes it work. So understanding what the customer wants, the customer being the end user, is really important. So let's talk a little bit about some extension of these principles and what they look like. So end user, design for the user in mind. Remember, the user is not only the end user of the application, it can be that person that at the end gets the data. I did some work with Resolve to Save Lives in India where we developed an app called the Simple. You can go to simple.org and see it. It's simple. What we noticed, what we learned, was that providers there saw 100, 150, 200 patients in a day. If they were going to enter a blood pressure and information, it had to work within 25, 30 seconds. Think of that compared to the US. The app was really designed to what is the minimum data set that you need to be able to make a difference, not just for that patient, but for the provider who's using the app. And then finally at the end for the population health to assess what's going on with that. So it's a great example of designing for a user. Doesn't get everything, but it meets the needs of the user. That's another example of the constraints. The environment was highly constrained because of the number of patients that had to be seen. So decisions were made about the application that reflected that. It has to be easy to use. Think about entering data on 150 people in a 10-hour day and what you need to be able to do. How much do you want to type? How much do you want to run the risk of misspelling? Common development of applications that can be used across the enterprise. If you develop an application for hypertension, can it be used for diabetes? Can it be used to assess food? Can it be used to assess obesity and other things like that? And responsive. Can it be responsive to the needs of the application? Technology and application principles. What kind of architecture are you going to use? You know, in places that have a lot of technology infrastructure, it's easy to remember that you can build an architecture just like you build a house. Things build on top of each other. But in a place where there's one application, it's not going to build on anything. In and within itself, it has to do everything. Technology diversity or consistency. Do you want something that everyone can use, or do you want something different? Do you want something that is used in one community or used throughout different communities but can be adjusted, for instance, to record a demographic data point like race and ethnicity? So you can use the same application, but you can get the specific data set that you need depending upon what data fields have been entered into that system. Commonality, I'm a big proponent of making sure that there's common use, that I don't have to learn new things. Think of new healthcare providers in resource-constrained environments that are traveling to different communities. It has to have an ease of use that enables them to understand what to do right away, and that's this commonality. And finally, hosting. Remote areas, client server is still a way to go. In other places, you see a real dependency on cloud where there's an architecture that works. Remember, however, data sovereignty matters. If somebody wants to own their data, a tribal community in the United States, they want their data on a client server app. They don't want anybody else to be able to get that data. We've seen this a lot in many communities in low and middle income countries. Countries don't want their data going outside their borders. We saw this with the Ebola epidemic in 2014. What happened in Sierra Leone initially stayed in Sierra Leone. People didn't share data outside of that. And finally, development. Understand the ecosystem. We've talked about this. Design with the user in mind. Be data-driven. Understand governance. We're not going to go into that here, but remember, data governance, application governance, technology governance, data sharing, all these are critical components that need to be addressed. And finally, we've already talked about using open standards. The standards should be standard terminology and messaging, both data and messaging standards. Open source is obviously a particular decision depending upon what you're doing. Open innovation means that you are pushing out things like to GitHub that people can follow and make sure that they can see what you've done. So how do you improve your chance of success? Be realistic, keep the scope manageable, iterate, learn, improve, iterate, learn, improve, and do something with the product. Make sure it's something that makes a difference. So during the global public health crisis, what did we do? We saw continuous surveillance of the environment. Lots of things came to a halt because of that sense of how do we work collaboratively and collectively during a public health crisis. How do we understand what somebody needs? If all of a sudden sharing information about COVID-19 lab test is the most important factor, then technology development shifts to that appropriately, in my opinion. We also need to map data processing. You need a tool that maps. Sometimes we use the back of an envelope, right? A, B, C, D. But at the long run, if you want something that replicates, you have to use tools that help you replicate. They can be tools, visual tools that are open source, or you can use business process modeling tools, business process nomenclature. But what the most important thing to do is to make sure that everyone that is using that understands why and what you're doing. Streamline your workflow, make sure the right people are at the table, make sure you understand people, process, technology. This concept of human-centered design, people, process, technology, it's a 3-word mantra. Remember it every time you look at developing something. What are the people? Who are the processes? What is the technology? And remember, use appropriate technology. Use the technology that can be reused again and again at the community you're providing for. And finally, do something that matters. Kind of a part of my life is making sure that what I work on has the ability to make a difference in people's lives. So thank you for your time. And I think later there'll be time to answer questions. Thanks.